Hi, I'm Dr. Peter Fotinakes. I'm the medical director of St. Joseph's Medical Center Sleep Disorder Center. I've been in sleep disorders for over 20 years now, and I'm happy to have this affiliation with one of the busiest and oldest centers in Orange County. St. Joseph's Hospital Sleep Center is an accredited center by the American Association of Sleep Medicine, and that means that we take care of all sleep disorders, from sleep-related breathing disorders to insomnia to disorders such as narcolepsy and things such as sleepwalking, body movements during sleep, and restless leg syndrome. Probably the two most common disorders that we see at the Sleep Disorder Center are sleep apnea and insomnia. Sleep apnea is something that afflicts probably about 10% of adult men and about 4% of adult women. About 50% of the population after the age of 35 snores every single night. Out of those people, about 1 out of 10 have significant sleep apnea sufficient to treat. Sleep apnea is a breathing disorder where people repetitively stop breathing after they fall asleep. They snore, the snoring pauses as they stop breathing, the people struggle to breathe, and then they suddenly wake up for a few seconds without knowing it, and then fall right back to sleep again. This problem causes a variety of different symptoms. It disturbs sleep, so people with sleep apnea tend to be very sleepy people in the daytime, and it also puts a strain on the heart and lungs. This is actually the most important part of sleep apnea, because if it's left untreated, it can lead into problems such as hypertension, pulmonary dysfunction, strokes, heart attacks, and even sudden death. So it's something more than just making noise at night. Sleep apnea is a medical condition that leads to a lot of other grave medical problems. Insomnia doesn't lead to grave medical problems, but it leads to vast human suffering. People who can't sleep at night have problems with everything else in their life. Sleep gives us a sense of restorative power in the daytime. It refreshes us, and people who can't sleep suffer badly. Now, many times people who have insomnia are written off. They're given sleeping pills, and the sleeping pills will take care of things for a short period of time, but often the old problems rise up again and they go back into their old sleeping patterns. And now they have to contend with using a sleeping pill and still having their insomnia. So our approach at the Sleep Disorder Center is to try to use behavior modification, cognitive restructuring, which are just fancy terms to teach people to sleep normally again. So insomnia is a very frequent problem. Probably every living adult will have problems sleeping occasionally. And about 20% of adults will have problems sleeping so frequently that it starts impacting the rest of their life. It impacts the way that they work, how they feel, their relationships with their family and their friends. So it's something that really creates problems in humans as they grow older, and it's very frequent, but it's left untreated or undertreated.